Hey everyone, welcome back to the channel. Today we need to have a real conversation about something that I see quietly undermining the health of so many people in my clinic. It's something we all know, something most of us have in our medicine cabinets, and honestly something a lot of people reach for like it's a miracle cure. I'm talking about antibiotics. Now, I know some of you might already be raising an eyebrow right about now. You're probably thinking, wait a second, doc, aren't antibiotics what we use to kill infections? Western medicine has been relying on them for decades. Are you really telling me they're bad for us? That sounds a little extreme. I completely understand that reaction. And that's exactly why we need to have this conversation. In my experience, one of the biggest mistakes we make in modern health is being misled by incomplete or incorrect medical information, thinking something is helping us when, in the long run, it might be doing a lot of hidden damage that we just don't see right away. So just take a deep breath, give me a few minutes, and let me walk you through this step by step. I promise I'll make it as simple and as clear as I possibly can without all the confusing medical jargon. Let's start with the very foundation of who we are as human beings. We are living, breathing creatures powered by our internal organs. And in the framework of traditional Chinese medicine, which I often integrate into my holistic approach when I talk to my patients about prevention, we see one organ as the absolute ruler of the entire body, the heart. Now, when I say heart, I'm not just talking about the physical pump that pushes blood through your blood vessels. It's so much more than that. In this system, the heart is considered the emperor. It's the seat of your consciousness, your emotions, your thoughts, your spirit, your very sense of self. It's the absolute boss of all your other organs, your liver, your spleen, your lungs, and your kidneys. Everything answers to the heart. Think of it this way. If you have a strong, wise emperor sitting firmly on the throne, all the ministers and officials, which represent your other organs and energy systems, are going to do their jobs perfectly. Your body becomes peaceful, healthy, and incredibly resilient. Outside invaders, things like wind, cold, heat, and dampness from the environment won't dare to attack. They see that powerful emperor sitting there radiating strength and authority. They know better than to mess with that kingdom. But what happens if that emperor gets weak or gets poisoned or falls ill? Complete chaos. The ministers panic, the borders fall, and the invaders rush in and wreak havoc. That's when we get sick, and that's when a simple cold can turn into something much more serious. This is exactly where my concern about antibiotics comes in. I am strongly against using them casually or unnecessarily. Why? Because from this traditional perspective, antibiotics are considered extremely cold and bitter in nature. While Western medicine calls it fighting infection, this system sees it as pouring a bucket of ice water on a roaring fire. And the very first organ that gets hit by that ice water bath is our emperor, the heart. It gets hit first, and it gets hit the hardest. Now, you might say, but doc, my cardiologist says my heart is perfectly fine, my EKG is normal, my blood pressure is great, I passed my stress test with flying colors, and that's a perfect example of where we need to look deeper. Those machines and tests are absolutely amazing at finding structural problems, a blocked vessel, a valve issue, an irregular rhythm. Things like that, they're fantastic for that, and I'm grateful we have them, but they cannot measure your heart fire, the vital energy, or chi that keeps your body warm, energized, and functioning properly on a deeper level. They can't see that invisible force. They can only see the physical structure. By the time those tests show a problem, the structure is already damaged. We want to catch things before they get to that point. We have our own full body scan in this traditional system, and it's right on your tongue, available to you at any time for free. The tongue is considered the mirror of the heart. If anything is going on with your heart, it shows up on your tongue faster than any lab test or imaging machine. It's incredibly sensitive and responsive. Here's a quick experiment you can do at home. Next time you have a sore throat or a cold and you take an antibiotic for a day or two, look at your tongue the next morning. Just stick it out in the mirror and take a good look. Normally, you might have a thin, white coating. That's a sign of healthy digestion and good stomach qi. It should be relatively even across the surface. But after you take that antibiotic, you might see your tongue coating become patchy with bare, red spots, almost like a map of the world with missing pieces here and there. It might look like someone took an eraser and rubbed off parts of the coating. In this system, we call that a geographic tongue. What are those bare patches? They represent your heart chi, or energy being depleted, like soil being washed away or dug out from a garden. It's a sign that the powerful fire of your heart has been weakened by that cold, harsh medication. It's a visible physical sign that your central energy has taken a hit. What happens when the heart is injured in this way over time? Many people think, well, my cold is gone, so I'm fine. I feel a little tired. But that's normal, right? Not so fast. Have you ever noticed that after a course of antibiotics, you feel completely wiped out for days or even weeks? You're more tired than usual. Your hands and feet get cold easily, even in a warm room. Your appetite is off, and you just don't have your normal get up and go. You feel kind of flat, more concerned. Your emotions can go completely haywire. I see this in my clinic all the time. A patient comes in, normally a cheerful, upbeat, easygoing person, but they've had a few rounds of antibiotics for a bad case of bronchitis or pneumonia over the years. Sure, the infection clears up, but suddenly they're dealing with low-grade depression, anxiety, or they're snapping at their spouse or their kids for no reason. They can't sleep at night. They're restless, irritable, and just not themselves. They tell me, Duak, I don't know what's wrong with me. I just feel off. Western doctors might label it as menopause. Generalized anxiety disorder, adult onset ADHD, or insomnia, and they might prescribe a sedative or an antidepressant. But if you look at it from this perspective, it's a heart that's been damaged. The emperor's palace is in ruins, so the spirit can't settle there peacefully. That leads to agitation, insomnia, irritability, and irrational thoughts. And the root cause of all this, the antibiotics you took for what seemed like a simple infection months or even years ago, but the consequences go even deeper. And this is where it gets really important for your long-term health. Have you ever wondered why cancer is so incredibly common today? Why we see so much lung cancer, liver cancer, breast cancer, colon cancer, and prostate cancer, even in people who seem perfectly healthy? Here's a fascinating perspective from this traditional system that I want you to consider. The heart never gets cancer. Think about it. You've heard of lung cancer, stomach cancer, bone cancer, even skin cancer, but have you ever heard of heart cancer? Not really. It's incredibly rare, almost unheard of. Why? Because the heart is the hottest, most active organ in your body. It beats day and night, 24 hours a day, 7 days a week, generating massive amounts of heat like the sun in our solar system. Cancer cells, on the other hand, are like mold. They thrive in cold, damp, dark environments, and they absolutely hate heat and sunlight. They can't survive in high temperatures. So when a cancer cell travels through your bloodstream and reaches the heart, it gets incinerated by that intense heat. It can't survive the journey. The heart is your body's ultimate anti-cancer defense, its strongest line of protection, its protective mountain, if you will. It's the last and most powerful line of defense you have. So what happens when you take those cold antibiotics again and again over the years for every little thing? You're constantly dousing that inner sun with ice water. Once or twice, you might not notice it, but over 10, 20, 30 years, that heart fire gets weaker and weaker. The temperature of your body drops, your lungs get cold, your stomach gets cold, and yes, your uterus or your prostate gets cold. Your whole internal environment becomes cooler. This creates the perfect environment, a cold, damp, dark soil for that mold cancer to grow and thrive. So in a very real way, overusing antibiotics can be seen as creating the very conditions for chronic illness. It's a form of self-sabotage over the long term, and it's something we need to take very seriously. So I'm asking you to take this seriously. Avoid antibiotics unless they're absolutely medically necessary for a confirmed bacterial infection. They shouldn't be your first stop for the sniffles or a mild cough. But I know exactly what you're thinking. Okay, doc, that all sounds good in theory, but if I don't take antibiotics, what do I actually do? When I get a fever or a pounding headache or a horrible sore throat, I can't just suffer through it, right? I have to go to work. I have to take care of my kids. I can't be in bed for a week. Exactly. And this is where we get to the really good stuff. Our medical ancestors figured this out almost 2,000 years ago and wrote it down in what we now call the Shang Han Lun, or the Treatise on Cold Damage. This text mapped out every type of common cold and flu and provided incredibly effective, time-tested herbal formulas. If you understand this system, you can take care of most common illnesses right in the comfort of your own home without ever stepping foot in a doctor's office or an urgent care center. It puts the power back in your hands. In this system, we group common colds and flus under the umbrella term Tai Yang disease. Think of Tai Yang as your body's border patrol or your immune system's first line of defense. It's like the walls of a castle or the border patrol at a country's edge. When an invader, a virus or bacteria, tries to get into your body, they have to get past this wall first. If the wall is strong, they get turned away. If the wall is weak, they get through. There are three main patterns of Tai Yang disease that you need to know. Once you know these, you can skip the urgent care for many common bugs and handle them yourself. The first pattern is called the wind cold or wind stroke pattern. Don't let that name scare you. This isn't a stroke like we think of it in Western medicine. That's a completely different thing. It means you've been struck by wind or exposed to a combination of wind and cold that your body couldn't handle. The key symptoms to remember are three. First, fever. Second, sweating. And third, a strong, almost irrational aversion to wind. Let me explain those in detail so you can recognize them. The sweating isn't workout sweat. It's not the sweat you get from running on a hot day or from being in a sauna. It's a clammy, uncomfortable, abnormal sweat that comes on without you doing much of anything. You're just sitting there on your couch watching television and you're breaking out in a sweat, and it doesn't make you feel cool or refreshed. It feels gross, sticky, and draining. Why does this happen? Because your pores, what we call your defensive chi, have become loose and weak. They can't close properly. It's like the city gates are stuck open and your body's precious fluids are leaking out. The third symptom, that aversion to wind, is very specific and very telling. You absolutely hate the feeling of wind on your skin. Even a gentle breeze from a ceiling fan set on low, or the soft spring air coming through a cracked window, things that feel good and refreshing to other people, feels like a knife cutting into your bones. You feel it right into your joints. You just want to crawl under a heavy blanket and hide from any draft. If you have those two symptoms, that abnormal sweating and that strong aversion to wind, and you check your pulse and it feels floating right at the surface, easily felt with a light touch, that's the classic pattern. You're looking at a wind cold pattern. How do you get this? Here's a classic modern example that I see all the time. You're at the gym, running hard on the treadmill or lifting weights and you're sweating buckets. Your pores are wide open, your blood vessels are dilated, and you're radiating heat. You get thirsty, so you grab a bottle of ice cold water from the cooler, or you stop at Starbucks on the way home and get a big ice drink with extra ice. That cold liquid shocks your system, and while you're cooling down, the air conditioning in the gym or in your car is blasting at 65 degrees. That cold, dry air rushes right into your wide open pores. Later that day, you walk outside into the evening breeze and bam, your neck is stiff, you can't turn your head, you have a headache, you're sweating, and you're painfully sensitive to the wind. That's the pattern, and it started with a simple combination of cold drinks and cold air for this. We use a classic formula called Gui Ji Tang, or cinnamon twig decoction. It's a simple, gentle, and incredibly safe combination of cinnamon twig, peony root, fresh ginger, red dates, and licorice. It's almost like a medicinal tea. Really, the cinnamon helps push the wind out of your body from the inside. The peony helps preserve your body's fluids so you don't sweat too much. And the ginger and dates give you energy and support your digestion. You take the formula warm, then you sip a bowl of warm thin rice porridge. Think of it like a warm chicken broth, but without the chicken, and you cover up with a blanket. The goal is to produce a light sweat, not a drenching one where you soak your sheets. Just a little moisture on your skin, like a gentle, misty rain. That sweat carries the wind out of your body. And in my clinical experience, you're often feeling back to normal within a day, sometimes even within a few hours. It's remarkably effective. The second pattern is called the cold stroke or cold damage pattern. Again, this is not the bacterial disease that we vaccinate against. This is when pure cold invades your body and locks it down like a deep freeze here. The biggest difference from the first pattern is that there is absolutely no sweating at all. You have a high fever, you're burning up, you feel like you're on fire, but your skin is dry as a bone, your pores are locked shut, and nothing is coming out. The chills are much more intense too. You're so cold that you could be under 3 heavy blankets with the heat cranked up to 80 degrees, and you're still shivering uncontrollably from the inside out. That cold is deep in your bones, and then there's the pain. Oh, the pain. It's a deep, severe, full body aching in your muscles and your joints like you've been beaten all over with a baseball bat or run over by a truck. Your whole body hurts. Moving hurts. Lying still hurts. Everything hurts. Many people reach for Tylenol or ibuprofen for this pain. But let me tell you, that doesn't fix the underlying problem at all. It just masks the symptoms temporarily. Why? Because this pain comes from pressure. Imagine your body is a pressure cooker. You're generating all this heat internally, and you need to vent the steam. That's the sweat, the natural cooling mechanism, but you've just been hit with a blast of freezing cold air from the AC. Or you jumped into a cold pool on a hot day, or you took a cold shower right after being overheated. That slammed the vent shut instantly. Now all that heat and pressure is trapped under your skin, pressing against your nerves, your blood vessels, and your tissues, causing that horrible, deep, Relentless aching, it's like a pressure cooker with the lid sealed shut and the valve blocked. To treat this, we use a formula called Ma Huang Tang or ephedra decoction, the main ingredient. Ma Huang or ephedra is like a dragon. It's powerful, direct, and effective. It bursts those closed pores wide open, releasing the pressure in a rush of sweat. In my clinical experience, the pain literally vanishes when that sweat appears. It's almost instantaneous relief. The fever breaks, you stop shivering, the pain is gone, and you feel reborn. Now, I want to correct a common myth here. Some doctors in the past have said, oh, we live in a warm place like Florida or California or Texas. We don't get cold strokes. That's a northern winter disease for people in Minnesota or Canada. That is absolutely incorrect. I practice in Florida, which is hot and humid most of the year, and I use this formula more than you would believe. Why? Because our modern environment is filled with artificial winters, blasting air conditioning in the office, in the car, and at home, jumping into a cold pool on a 90-degree day, drinking iced coffee and smoothies all day long. Walking into a grocery store that's freezing cold when it's 100 degrees outside, these all shock your system and lock the cold into your body. It's a universal human problem, not just a winter one. Don't let the season fool you. The third pattern is called the warm disease pattern. This is where a lot of confusion happens. Even among some healthcare providers, many doctors see a fever and immediately assume it's a heat condition, and they reach for cold, cooling herbs or antibiotics or fever reducers. But this pattern is different. The key symptoms here are a fever, an intense, unquenchable thirst. You want to drink ice water constantly. You can't get enough, and importantly, no chills at all. You actually feel hot and want to kick the covers off. You don't feel cold, you feel overheated. This often happens when you got chilled in the winter, but the cold was tricky. It didn't show up right away. Instead, it burrowed deep into your body, hiding in your muscles and bones like a spy lying dormant, waiting for the right moment. Then, when spring comes and your body's natural energy starts to rise to the surface, it pushes that spy out. That's the fever. We have specific formulas for this, including variations of formulas like GE Gen Tang or kudzu decoction and others. But the point is, you treat it differently than the other two patterns, and you don't just throw antibiotics at it. So to summarize those three patterns, if you have a common cold or flu, stop and look at your symptoms. Are you sweating? Are you chilled by wind? Are you in severe pain? Are you thirsty? Are you cold or hot? These signs tell you exactly what's going on at your body's border, and they guide you to the right natural solution. It's a simple, elegant system. Now, going back to the heart, why do I keep bringing this up? Why is the heart so central to all of this? Because as long as your heart is strong, these invaders stay at the border. Let me explain what I mean in more detail. If your heart fire is strong and your energy is high, the invader gets stuck at the Tai Yang level, at the very surface of your body, like at the front gate. Even if you don't take anything at all, your body might be able to fight it off with rest fluids. And time, the invader can't get into the inner palace where your vital organs live. But if you take antibiotics, you weaken the heart, and suddenly that border wall is as weak as wet paper. The invader sees that the emperor is down, the city gates are open, the guards have abandoned their posts, and it rushes right in without any resistance. Where does it go according to this system? If the invader gets past the Tai Yang border, it moves deeper into the body in a predictable pattern. It might go to the Yang Ming level, which relates to your stomach and large intestine. You get a high fever that doesn't break. You pour sweat even though you're not exercising. You're incredibly thirsty and you get really constipated. Sometimes you might get delirious from the fever. This can be uncomfortable and scary, but the good news is in this system, it's rarely life-threatening, it's uncomfortable, but the body can usually handle it. If the invader doesn't go to Yang Ming, it might go to the Shaoyang level, which is the hinge between the interior and exterior. This affects your lymphatic system and your gallbladder here. You get alternating chills and fevers, like a roller coaster. 1 minute you're freezing and shivering, the next you're burning up and throwing off the covers. You get a bitter taste in your mouth, you feel dizzy, and you just don't want to eat anything. You might feel nauseous just looking at food. This is more tricky and uncomfortable. And if the disease gets past that, it goes into the yin levels, the spleen, the kidneys, and the liver. This is when it becomes a chronic, deep-seated issue. This is where autoimmune conditions, chronic fatigue, fibromyalgia, and serious life-threatening illnesses can take root. This is when a simple cold becomes a chronic health problem. And what is the single most important factor that prevents all of this from happening? Your heart. A strong, warm heart keeps the disease at the surface. A weak, cold heart lets it sink in and take root. It's that simple. One more critical piece before we wrap up, and I want you to really pay attention here. Your mood, I've seen this so many times in my clinic. A patient comes in with a simple, easy to treat cold textbook case, but they're under incredible stress. They got into a huge argument with their spouse over something silly last night, or they're stressed about a deadline at work that's keeping them up at night, or they're worried about money, their kids, their aging parents, and suddenly that minor cold turns into something that lasts for weeks, or it turns into bronchitis or pneumonia or a sinus infection. Why? Because anger, frustration, anxiety, and chronic stress damage the heart's spirit. It's like the emperor is having a temper tantrum or is paralyzed by fear and can't lead the troops effectively. The defense system drops, the protective energy retreats, and the invader waltzes right in. In the old text, they say that anger injures the liver, but more importantly, it disturbs the heart. And when the heart is disturbed, the protective energy, the Wei Qi, just gives up and goes home. So I always tell my patients, even when you're sick, try to find a little bit of joy or humor in the situation. I know, easier said than done when you feel terrible, but try it. Tell yourself, hey, you know what? I get to stay in bed and binge watch my favorite shows today. My boss can't ask me to do anything. The laundry can wait. The dishes can wait. The world can wait. Ask your partner for a back rub or a foot massage. Ask your kids to bring you a glass of water. That feeling of being cared for and allowing yourself to rest. That's real medicine. It strengthens your heart chi and gives your immune system a huge boost. It's not just positive thinking, it's the highest level of physiology. In my opinion, a happy heart is a strong heart. Now, here's a quick tip on how to tell if the disease is progressing or if it's staying put right from the Shanghan Lun, feel your pulse. If you have a cold for about 6 or 7 days and your pulse is still stable, it's still strong, floating, and superficial, just like it was on day one, that means the disease is still at the border, your body is holding the line. You can still treat it effectively with the right formula, but if your pulse suddenly becomes rapid and intense, like it's racing, or if you start feeling incredibly restless, you can't sit still, you're pacing around the room, and you start feeling nauseous and like you're going to throw up, that means the disease is going deeper. It's heading toward those inner organs. At that point, you need to see a healthcare professional. Don't try to handle it at home. That's the sign that you need help to bring it all together. Protecting your long-term health and avoiding serious illness comes down to two main things. Number one, don't misuse antibiotics. They are a powerful and essential tool for severe bacterial infections, and I'm grateful we have them for emergencies like sepsis or bacterial pneumonia. But for a common cold, a mild flu, or a viral sore throat, please think twice. They're like throwing a bucket of ice on your body's central fire. Every unnecessary dose is potentially weakening your defenses and paving the way for future issues, including digestive problems, mood disorders, and even chronic conditions down the line. Number two, protect your happiness, manage your stress. Don't let anger or anxiety take over your mind. Find ways to laugh, to relax, to connect with people you love. Smile even if you're not feeling 100%. That act alone can be a powerful defense. When you're happy, your immune system works better. It's that simple, and it's backed by a lot of modern research too. And beyond those two core principles, here are a few modern day traps I want you to avoid. First, never drink ice water immediately after a heavy workout. I can't stress this enough. This is one of the fastest ways to shock your system and cause problems. Your blood vessels are dilated, your pores are wide open, and you're radiating heat. That ice-cold liquid hits your stomach, constricts your blood vessels, shocks your heart, and creates a conflict between the internal heat and the external cold. That can lead to lingering colds, digestive issues, and even joint problems down the road. Drink room temperature water or warm tea instead. Your body will thank you. Second, don't sleep directly in the path of the air conditioning. Your body is a finely tuned machine. A blast of cold air on your neck while you sleep is a recipe for feeling miserable the next day. You'll wake up with a stiff neck, a headache, or a full-blown cold. Turn the temperature up to 76 or 77 degrees at night, and make sure the air isn't blowing directly on you. Wear a light layer to bed if you need to. Third, trust your body. Our bodies are incredible complex systems that have evolved over millions of years. They are far more sophisticated than any machine, and they possess a remarkable ability to heal themselves. A fever is often your body's way of fighting off an infection and cleaning house. It's not the enemy. Our job is to support that process, to give it the warmth, rest, and energy it needs, not to fight against it and shut down its signals with cold medicines, fever reducers, or antibiotics. I want you to walk away from this video with this thought: your body is yours. I'm here as a doctor to help guide you and educate you, but the real power lies in your daily choices. Don't hand over all your health power to a pill or a quick fix. Trust the medical wisdom that has been proven over centuries, treatments that have stood the test of time on millions of people. That's what I call real science. I hope you'll take this to heart, walk away from unnecessary antibiotics. Let go of that anger and stress, ditch the ice drinks after your workout, and turn down the AC. I truly believe that if you do these things, you'll feel lighter, stronger, and more energetic. Those nagging issues, the fatigue, the cold hands and feet, the restless sleep, the irritability, the frequent colds, they can start to fade away. You can build real lasting health. And when you're 90 years old, still sharp as a tack, walking without a cane, traveling, enjoying your grandchildren, and living your best life, you'll look back and thank yourself for making these changes today. You'll be glad you took control of your health when you had the chance. Thank you so much for spending this time with me. I know it was a longer video, but this is important stuff, and I wanted to give it the attention it deserves. If you're going to try any of these tips, or if you have questions, drop a comment below and let me know. I read them. And remember, this is for educational purposes only. Always consult your own doctor before making any changes to your health routine. If you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science and the traditional wisdom, not replace professional medical advice. Take care of yourselves, be kind to your heart, and I'll see you in the next one.